Hello and welcome to Lindamood-Bell Radio, a podcast exploring literacy and learning. I'm Dave Hungerford for Lindamood-Bell, and today I'd like to welcome Dr. Robert Hendren, who I'll introduce in just a minute. Apropos of today's topic, many students with autism have received instruction at Lindamood-Bell's learning centers using the Visualizing and Verbalizing program. We teach students how to visualize the language they read and hear in order to improve their ability to comprehend and think. This is especially helpful for students with autism. Language comprehension is foundational to learning, both academic and social. With a better understanding of subject matter and social relationships, students with autism are poised for greater success in all areas of life. To learn more, visit our website, lindamoodbell.com, or contact us at 800-233-1819. But today I want to welcome Dr. Robert Hendren, who is a professor of psychiatry and behavioral science, the Division of Child and Adolescent Psychiatry, at the University of California, San Francisco. From 2001 to 2009, he was professor of psychiatry and executive director of the UC Davis M.I.N.D Institute. Dr. Hendren is past president of the American Academy of Child and Adolescent Psychiatry and has published well over 100 scientific papers and 5 books. He's been listed in The Best Doctors in America each year since it was first published in 1996. Dr. Hendren, welcome.
Great to be here. Great to be with you. Thanks.
I know that a big part of your work and research is focused on autism, and our audience includes a fairly wide range of individuals, parents, teachers, and professionals. And I'm thinking about 3 kind of broad categories of questions about autism that could be of interest. The latest thinking about possible causes, the identification of the disorder, and of course, approaches to mitigate some of the associated behaviors. Let's start by talking about some of the possible causes or etiologies. What's the latest research pointing to?
Well, I think in a broad way, it continues to point to a gene-environment interaction. So genes that give people neurodevelopmental vulnerability interact with each other and with the environment to lead neurodevelopmental growth to point towards autism. So there doesn't seem to be one particular gene. There's not even 2 or 3 particular genes. We think there may be at least 100 that vary between different people with autism. And those genes may or may not express themselves, but they interact with each other and they confer this vulnerability. So sometimes the genes might come from the mother or the father, but sometimes the genes are what we call copy number variants, meaning something changes the gene in a child, but it doesn't come from the parents. The second part, though, of this, the so-called second hit of creating someone with autism, is an interaction with the environment. So there are things in the environment, and we can't even say for sure which ones exactly, although there are things in the past that said if you have rubella, measles, during pregnancy, there's an increased likelihood that your child will have autism. If you take valproic acid, Depakote, during pregnancy, there is an increased chance, and we know those are cause and effect. But the other environmental causes are things like toxic pollution, saying that if you live near a highway or freeway where there's lots of diesel dust, or if you live downwind of a coal burning plant, or if you live near a field where they spray pesticides, there's an associated risk of greater amounts of autism. So that's not cause and effect, but it is an association that says those environmental factors and many more seem to play a role in the way that they interact with this genetic vulnerability to create somebody who begins to develop autism. Now, that may develop into full-blown autism, or people may get early interventions that alter the course of that. And increasingly, we're learning ways that we can intervene early or that there may even be things that we could do around pregnancy that improve the body's ability to be healthy and push back. We don't know those things for sure, but there's that likelihood. So it's a long answer, but the short answer is that it's an interaction between genes and the environment.
And still much research needed to be done, it sounds like, to pinpoint it.
And people are working hard to see all of these factors, because if we could know better, then maybe we could do things to prevent or at least lessen the effects of autism.
I think of the West Coast and the East Coast and so many people living near freeways, and you said that that is one potential piece of the puzzle. Is that something that maybe we've all read about, the increase in the diagnosis itself to, I think, what is it, 1 in 100 and under 130 births are affected? Could that be part and parcel of the increase in diagnoses as well?
Well, it's a heated debate about whether there's more autism or whether we're just recognizing it more. So what we do know is there's an increase in prevalence, which means as we keep counting autism, we see more and more each year as people grow older. But incidence would mean new cases of autism, and those are not as easy to count, and they're the ones that we'd have to count in order to say for sure that there was actually more. It's that because we keep seeing it more, we diagnose it more frequently, people have come to accept the diagnosis more. So maybe people come in hoping to get a diagnosis of autism for their child so that they can get better services. Sometimes there's an increased acceptability. Often times that we might have called somebody odd or unusual or not having great social skills in the past, now we might call them autism. So some people say there isn't more, but I'd say there's an increasing agreement that says it's about half and half. Half is we've changed our diagnostic practices with the evolution of our diagnostic system, and there are increasing toxins in our environment that interact with the genetic vulnerability. And each of those contribute to the increase in autism that we see.
So I guess maybe stepping back a bit, it is a spectrum of behaviors that contribute to that, and it's a wide range of behaviors from severe to not so much. How do we define it now?
Well, we've defined it in the DSM-5, which is our latest diagnostic and statistical manual, by talking about there being impaired social interactions along with difficulties with speech and language at times. That's not necessary. It used to be. But now those impaired social interactions. And then the second is repetitive behaviors. That the two coupled together is how that diagnosis is made. But there isn't a blood test or there isn't a brain scan. It's generally done through a careful, thoughtful exam by a skilled professional who, at the least, uses the DSM-5 criteria and says that someone fulfills it. They may use other rating scales. A good screener is called the MCHAT, but there's the Social Communication Questionnaire, and there's one called the CARS. Those don't make the diagnosis by themselves, but they indicate a trend in that way. And then many times people require an interview and examination by a skilled examiner for what's called the ADI, the Autism Diagnostic Inventory, or the ADOS, the Autism Diagnostic Observation Schedule. They need to be given by people who have been trained to give them. The ADOS might take 20 minutes to a half an hour. The ADI is more of a history, and that sometimes takes, at the very least, 45 minutes to an hour, sometimes 2 hours or more, where there's a careful history that's gathered following particular questions, and then that score leads to the diagnosis. Often, like here in California, our regional center requires an ADOS and ADI to make that diagnosis. Sometimes insurance companies or others will accept a skilled, trained practitioner who uses DSM-4 or DSM-5 criteria to make that diagnosis. That's generally how it's made. Sometimes in the schools, too, there might be some additional testing, and people also need to rule out things like intellectual disability or a hearing impairment, or some other genetic disorder that's not autism, that might be more clearly a single gene genetic disorder, that then they'd rule that out and not make the autism diagnosis and call it a genetic disorder.
You mentioned earlier brain scans, that there is not a clear-cut look at a brain that would have triggers or points, say an fMRI or a DTI that would point toward autism. Is that true?
Yeah, parents come in saying, well, can't you do a brain scan, or couldn't you do a blood test that could tell me that? And we're getting closer to that. There have been reports of people using MRI or using something called metabolomics or some other kinds of blood tests that can, with a fairly good accuracy, like 70 or 80%, say this person is likely to have autism. But it hasn't been studied enough and replicated enough to have it come to the point where that's now a reliable diagnostic marker that could have someone say that's what changes. And we find multiple brain changes on MRIs in people with autism, and they're not always the same for each person with autism. And we find multiple genetic disorders that are not always the same, and a variety of others. So we talk about there being multiple kinds of autism, or the autisms, and that creates a challenge in making a diagnosis other than just by symptoms.
And what does your facility there, what sort of services do they provide? I know that you were formerly with the M.I.N.D Institute in Davis, California, and have migrated to the city. What does UC, the center there, provide?
Well, at both places, we had people that were skilled at doing the ADOS and the ADI to make the diagnosis. We have a number of research studies where people can enter those research studies, but no research-based. They're not going to provide new information for people in terms of making treatments, at least at this point. It may be that we'll see some changes that then will lead us to try a treatment in a research study and then say, did that make a difference or not? And the centers also do assessment for intellectual abilities, sometimes fairly severe intellectual disability could be confused with autism. Also rule out other kinds of disorders that might account for it, so a good diagnostic interview. People say that maybe the reason we used to see less autism and we see more now is that we used to call autism intellectual disability, or we used to call it schizophrenia. They're pretty different disorders, so it's hard to fully imagine that that accounts for all of the change, but there are times that people can miss that, or even severe ADHD can sometimes appear with poor socialization, and people can wonder if that's autism. So it takes an evaluation by a skilled practitioner to know how to eliminate other disorders or rule those out and then make the diagnosis of autism. And most academic medical centers and most large medical centers have that capability.
And I know as we talked about some of the potential causes, one of the things that you did not bring up was probably the hot topic of vaccines and their role in that. What is the current status of science on that, or the current viewpoint?
Well, it is a hot topic. There are a lot of really strong parents, a lot of strong beliefs. A lot of thoughtful parents I know believe that their child had vaccine-induced autism. But when you talk about the science, there's no evidence in the science that vaccine causes autism. So when they've done studies, large population studies, looked at populations that have not been vaccinated, populations that have, looking at all the different kinds of factors that could be involved, it's a hard study to do because it's a small number of people with autism and it's a large number of people that get vaccinated. So to say how many of them did or didn't have vaccines and how many of that seemed to happen right at the moment that people thought that it did is tough. But I'd say the great majority of medical practitioners, the great majority of scientists would say vaccines do not cause autism.
Is there a moment
almost all of us? Go ahead.
Is there a moment where somebody is without autism and then there's a threshold or something changes where in the environment and the genetic propensities cross and that they turns their life?
Yeah, there seems to be a kind of time where people can show a downhill trend going towards autism at about 18 months, which is also about the time people get vaccinated. But many parents will say, my child was developing relatively normally, they had words, he or she was talking, used mama and dada, and did all these other things. They got vaccinated, developed a fever, they just seemed to go downhill, and then they began to lose language, and they began to lose their previous socialization abilities, reciprocity, looking back and forth at someone. And those parents would say, I think this was due to the vaccine. There have been studies, developmental studies, showing that kids, whether they have a vaccine or not, show a downward trend at about 18 months. And science has said that doesn't occur because of the vaccines. It occurs just because that's the way autism develops, the way it hits. And there can be a normal development and then things slide off. Convinced parents, and there are some practitioners that would say, no, it was maybe the fever during pregnancy, during that time that they had the vaccine, maybe it's something that interacts with their immune system, but no one has found any evidence for that. And so there's real concern that parents then don't vaccinate their child. And the concern for disease or disorders that can happen from not being vaccinated, those risks are far, far greater than any risk that anybody's ever seen for autism being caused by that vaccination. So I think the huge majority of practitioners would say parents should vaccinate their kids. Those that are cautious may say, well, make sure your child is healthy. Don't give a whole bunch of vaccines all at one time. Find a practitioner that you can work with that can spread the vaccines out or maybe delay them a little bit, and find ways to make sure that the immune system doesn't get overwhelmed if that's really somebody's concern. Although many pediatricians say there's no evidence for this, I'm not going to try and alter all my vaccinations and practice that way and say to parents, if you want to do it that way, go see another practitioner. And some practitioners say if you're not going to have your child vaccinated, I don't want to treat your child. And some schools say if you don't have your child vaccinated, you can't bring your child to school because if they get one of those disorders, they expose all the other children. And there's some notion of herd immunity that if everybody's vaccinated, then the chance of the herd getting exposed and having a problem is far less than if, say, 10% is not vaccinated, which is a strong argument that public health officials have, and the reason that some schools won't take kids and some practitioners won't take kids. And it's created an unhappy standoff between parents and practitioners.
I've seen very, very upset parents, probably on both sides of the issue in the media, certainly.
Yeah, I think they are. And I think often practitioners just give a real straightforward, quick answer that there is no evidence that vaccines cause autism. End of the discussion. That's get your child vaccinated. That's what you should do.
Well, I know that you've studied a lot of integrated approaches, including biomedical ones, on helping to ameliorate some of the symptoms that are problematic. Maybe you can tell us a little about what you have found in your research regarding that.
Well, I think there are kind of 4 levels of intervention that we can make with kids with autism, and we ought to make at least 3 of them. The first is thinking about behavioral interventions, and they're the ones that are the most proven. That starting with things like discrete trial training, going through TEACH, and then pivotal response training, on to things like RDI, relationship-based therapies, floor time, and then to the Early Start Denver model. That most of those have good evidence that they work, that they make a difference for kids with autism. They work, on a behavioral level, but if someone is young enough and the treatment is working right, it tends to go down even into the brain areas and to make changes that work well. The next level of kind of intervention is to think about medications. And there are no medications that treat the core symptoms of autism. There are medications that treat associated symptoms. So things like aripiprazole and risperidone treat irritability in autism, and that's often associated with aggression. So kids with a lot of aggression or a lot of anxiety or a lot of irritability can benefit from those strong medications, and yet they need to be used cautiously because they have side effects like increasing glucose, increasing a risk for tardive dyskinesia, increasing a risk for diabetes. The tardive dyskinesia is very rare. The diabetes is quite rare. Increased lipids is a little less rare, but all of those aren't necessarily great things. About 40% of kids with autism also have ADHD, and they benefit from stimulant medication used cautiously, can help them focus better. Sometimes we use SSRI medications like fluoxetine or Prozac or sertraline or Zoloft. Those seem to help sometimes with repetitive behaviors. And then there are several other classes of medications that can be used that can be helpful, but they're all treating symptoms. They're not making autism better. But there's some thought that in this gene-environment interaction, some of the things that we see that are altered are things like the body experiences inflammatory processes or experiences oxidative stress, or the mitochondria, the little energy cells that drive your body, aren't as healthy and working as well, or that things like free fatty acid metabolism isn't working as well. So taking supplements that might affect those processes is beginning to show preliminary evidence that it might make a difference for kids with autism. The studies of these things are hard to do, in part because the changes are small, so you need to study them for a long time, and you need a large sample size. Drug companies generally aren't interested in sponsoring those trials because they can't get a patent, and they're not going to be able to then make the money back that it costs them to do the trials. And it's often donors or foundations or small funds that will fund some of these trials.
I would imagine it's difficult to have parents serving as controls too with their children, and or subjecting them to things that are out of the mainstream.
Yeah. If a parent thinks that you're using vitamin D3 and it might help, they think, well, I can go buy vitamin D3 and give it to my child. So there isn't a way to have the control and make that work in the same way. But there are some beginning trials suggesting that that helps. And we've done 8 or 10 of those trials, some with omega-3, one with methyl-B, 2 with methyl. We just did one with something called sulforaphane, which is a concentrated broccoli sprout extract that was developed to treat oxidative stress in cancer. And some astute observer noticed that it also helped what's called heat shock protein. And kids with autism sometimes do better when they have a fever. So he did a trial that was randomized and controlled and showed sulforaphane separated from placebo. And we did a trial with a brand of sulforaphane called Avmacol that we used biomarkers for outcome measures that showed oxidative stress improved, and 7 other biomarkers did, along with the improvement in the children. And those with greater improvement in those biomarkers showed greater improvement in their symptoms of autism. So you'd have to eat a ton of broccoli to get enough.
I was going to say, were they able to make it not taste like broccoli? That would be the scientific breakthrough.
It doesn't. Comes in a powder, and some of the kids don't like the taste of it very well. So that's hard, and that's hard for some of these treatments like omega-3s. Some kids don't like the fish oil taste, and the fish burps. You can get omega-3s from other things like krill oil and flaxseed oil if they don't really like that. But those seem to help, not like showing huge effects, but making a difference, and at least theoretically helping the body be more resilient, helping it push back in this gene-environment interaction so that they can go more towards health. And that has been what's interested me ever since I was at the M.I.N.D Institute, when parents said, leave no stone unturned about what might cause autism and how it might be treated. Do good science, but keep an open mind. And so when I hear people say maybe this or that works and it seems safe, then I feel like giving it a try and doing it in a good study so that we can really see those effects with good measures. And some of these have shown some improvements.
You have to feel for the parents with so many different areas of life to try to juggle and plan for, and come up with a plan in each of the different areas.
Really hard, and many times parents will go to their traditional doctor and say, I'd like to think about these supplements, or I'd like to think about, other kinds of treatments, even something as radical as chelation. And the traditional doctor will say, no, that doesn't make any difference. We don't want to talk about that. And so the parents don't ever talk to that traditional doctor anymore. And then they go to an alternative, or maybe an integrative medicine specialist, or someone who might suggest some of these other treatments, but say, don't take those other traditional medications, or don't follow what that traditional doctor is telling you to do. So then parents get to a point where they don't discuss either with either sets of doctors, and they feel like they're left alone to make decisions about what to do with their child. And yet I've admired so much when parents tell me, I just want to try anything that isn't really harmful that might help my child. My child has autism, and I'd like to help them do as well as they possibly can. So I do think it's a hard load to carry at times for parents, and a little over 60% of families end up in divorce. It's just stressful on marriages, stressful on individuals, and then sometimes people feel isolated because their kids may not play well with other kids, so they don't play with other kids, and it's tough.
Yeah. Is there a high incidence?
Their support group.
Is there a high incidence of, like, within a family having several siblings on the spectrum?
Well, the odds go up. So it goes from about 1%, if you're just talking about a random person in the population, although there was one study in South Korea suggesting even being on the spectrum might be a little over 2%. But if you have a sibling with autism, the odds go up to be somewhere between 10 and 18%. Different studies have reported different amounts, but that goes way up. There does seem to be some spacing effect. So the further apart the kids are born, the lower the autism in the second child. But I see families with, one place on the spectrum and another kid at another place on the spectrum. Sometimes I've seen it in 3 and 4 of kids in a family. And, I think that's hard. And I know parents that have one, knowing those statistics, will really hesitate to try to have another child because they just feel like that would be especially hard.
You mentioned when we were talking about some of the therapies, chelation. I've heard you describe that before. It was pretty interesting. Could you give me a brief thumbnail on that again?
Well, we use chelation when kids get lead toxicity. Chelation is something that pulls a heavy metal, almost like a magnet would pull it out of the system. And when a kid is toxic on lead, it makes good sense to use chelators. There are some who think that perhaps autism is caused by heavy metals staying in the body, particularly mercury, and that using a chelator might help pull out those heavy metals. There are a couple studies that suggest chelators are safe when they're used right. There's no studies with autism really showing that they're effective, but there are anecdotal reports from people saying it is. Others say we could do things other than chelation to help the body rid itself of toxic substances like heavy metals using glutathione or other things rather than chelation. But there's been one reported death from chelation. I think an inexperienced practitioner, used the wrong kind of chelator. And so if a family tells me, I'm just going to try it, I don't care what you say or anybody says, I just feel like I've got to do it, I try and make sure they find somebody that knows what they're doing, and then talk to them about whether that seems indicated, and I want them to come back and tell me how it works for them. I don't want to lose them as a patient over their independent decision to do something that's legal if they want to try it. Mm-hmm. But you often hear people say, oh man, people die from chelation, and so you really have to be careful. Not a lot of people die from chelation, but people who get the wrong chelator do, and that's a small number, but there isn't great evidence that it really helps. And because it's pulling out heavy metals, which someone thinks might be mercury or lead, and it pulls out other heavy metals, and the skilled practitioner needs to know how to replace those heavy metals that are essential to have in the body.
Is it a matter of taking some medicine that attaches to the metals and then it's excreted.
Well, that's how you get that, and they use it. That's how you do the chelating. Yeah, you try and balance for the metals taken out by using supplements that have those heavy metals. But it's not like you put a big magnet on your body or something. Yeah. It's more that you take this medicine and then it's excreted through your body and you get rid of it that way. And I think even those people that were avid chelators in the past are trying to find other ways that can actually remove toxins and think that helps kids that have autism.
Well, it sounds like there are a lot of possibilities. So, yeah, go ahead.
Yeah. Well, I guess, that's kind of working down further, but all the way down would be to say could do genetic reengineering, and that's pretty controversial to think that you'd change someone's genetic structure if we even knew what to change when we're talking about hundreds of genes involved. How would you know how to change those genes? Also, I think there would be some controversy about altering people in that way. There is a movement called the neurodiversity movement of people that say, I've got autism, so what? Don't try and change me. Don't make me into something other than that. Accept me as I am. Take me as I am. I 100% agree with saying everybody with autism deserves as much respect as any human being deserves, that they should be treated as well as everyone is treated. They should be given all the respect that they should have. But when I hear some parents of kids with autism faced with that neurodiversity movement say, well, I'd like my kid to do the very best that he can, and if I can help him have better social skills or not be so repetitive and get stuck on things, I'd like to do that. So I guess I do want to change him, but I still love him just as much, whether he has that or not has that. I think that to me is the right philosophy.
So are you hopeful that there's going to be are there any breakthroughs looming on the horizon in the research? Is there a particular avenue that has you excited that you hope to see something change shortly, or is it a continuation of a long, steady journey?
I think the conservative view would be that it's a continuation of a long, steady journey, but I think my hopeful side is that we're going to start picking off subtypes and helping them do better, that we'll find kids that have particular genetic or metabolic or gene expression patterns that we can match a treatment to and that they can do significantly better. We might find things that we could do. I think we have found things, but we could use them thoughtfully from before pregnancy through pregnancy to after pregnancy that helps the body be more resilient, that helps kids maybe not ever have autism when they might have before, or at least have a much milder form of it. I think we may discover things in our environment that we could help take care of, although I think that's going to be really hard. I think our environment is going to take a long time to clean up. And so, but I feel very hopeful, and I think we're increasingly sophisticated in some of the techniques that we're using for kids that are really making a difference for them. So in that way, I think we've made great progress in the past 30 or 40 years, and I think we'll make great progress in the next 10 years.
Do you have some areas where you would point parents that are interested in finding out just more general information, but even B, specifically more about your work? Where would you point them to?
So I think a great resource for parents that have someone on the spectrum is the Autism Speaks and the Autism Society websites. And there's some National Institute websites that are great as well, but you get referred to those from either Autism Speaks or Autism Society. They both have a lot of really good information, help parents a lot. You can learn about different treatments, and I think that part works well. I think to learn about some of these integrative medicine or a little bit complementary kinds of treatments, there's a website that's called Autism Research Institute, just ARI, and if you Google that, you'll get to autism.com, and that will give information about some of these treatments, including ratings by parents that would say how well it's worked for them. It's not a randomized study. It's like parents who go to that website fill it out, and yet it gives parents additional information. You can go to PubMed, PUBMED.gov, and you can search on different studies, or you can search on people's names. You can search on my name, or you could search on methyl B12 and autism, or you could search on things that will take you to articles that have been peer-reviewed and published in good magazines, good journals, that aren't like just going to Google or another website that could take you to a bunch of kind of opinions that are interesting to read too, but they're not really as factual. But I encourage parents when they're struggling with what to do about this or that treatment that they've heard about, stem cells or hyperbaric oxygen or a variety of other things, to go to PubMed and then Google it, or go to PubMed and look there and see what they can find, and then make a decision about whether that's worth the time and expense, and in some cases risk, or whether it's not. And hopefully they can find a good practitioner or doctor that they could discuss that with and feel like they have a way of making the right decision for their family. I think the things that I'm most passionate about is trying to make the body more resilient, that we can improve health a lot. Kids can show a lot of improvement, but not all kids do show improvement. I worry when some parents try everything and their child doesn't show great improvement, and they feel like, well, then, did I do something wrong as a parent? Is there something, that I should feel guilty about? And I think some kids just have a way that they're put together with this gene-environment interaction that doesn't respond to the treatments we have right now. Maybe they will someday, although it gets harder to make significant change as people get older, but there's still always room for change, no matter how old somebody is. And I think the challenge that parents really face, especially now, is if their child continues with significant symptoms of autism, what to do with them as they become transition age youth and young adults, in finding services and suitable living arrangements and healthcare that understands adults on the spectrum. I think those things are getting better, but I think we've lagged behind in that, in getting good services for all the people on the spectrum of all ages.
Well, I really appreciate your time today and your expertise.
Sure. And I always like working with Lindamood-Bell, and glad that we had a chance to work together again.
And I want to thank you listeners as well for listening to Lindamood-Bell Radio. We listen to your feedback. Visit us on Facebook, Instagram, Twitter, and YouTube. We are Lindamood-Bell.